afternoon, and welcome to the Your Health radio and television program on the radio at AM 1240 KNRY, AMP Cable Television Channel 24, and on the web at www.ampmedia.org. Join our rotating host and their informative guests live every Monday afternoon at 4 o'clock. The purpose of the Your Health radio and television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
Welcome back to Your Health radio and television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm so happy you could join us today for our program. My first guest today, the illustrious Dr. Jeremy Silk, plastic surgeon. Dr. Silk, thank you so much for joining us.
Thank you, Dr. Morwood.
Now, Dr. Silk, I understand that you're recently board certified. So tell us what it means to be a board-certified plastic surgeon. You know, I gave an introduction when we started the program that I am a board-certified plastic surgeon, and so are you. Certainly. I want to say welcome to the club.
Thank you.
And let's explain to our audience what we mean by board certification or board certified.
Sure. So in the last year, I became board certified, and that means that you've been approved by the American Board of Plastic Surgery, which means that amongst your colleagues as plastic surgeons, you're now sort of an official member. You're allowed to practice as soon as you finish your training. And in plastic surgery, I think it's really important to have that credential. It takes a couple of years before you're eligible to get it. It is the patient's guarantee and really the board's guarantee that you're a responsible person. You have to pass a series of examinations, and they look through your cases. They make sure that you're doing an adequate breadth and depth of cases to make sure that they can test you. And once they're sure that you're safe to test, it's sort of their stamp of approval from really the most important body as far as plastic surgery is concerned, that you are an official and safe person, because as we all know, there are plenty of people out there doing plastic surgery procedures who have varying levels of qualification.
Right, Dr. Silk. So I do want to briefly go over, now aren't there three general categories of exams or criteria to pass? Now I know you have to finish, not only attend, but you have to finish an accredited plastic surgery training program. And that's normally associated with a major university or a very large hospital.
Correct.
So you've done that?
Correct. So you have to go through, in addition to medical school, you have to go through a residency program and complete it in order for the board to be satisfied. I'm actually double board certified because I completed general surgery and am board certified in that as well.
Excellent.
So I have a double board certification in general surgery and plastic surgery. I then went on, after 5 years of general surgical training in Arizona, I went on and did a 2-year fellowship at the University of Kansas. And that was my official plastic surgery fellowship. So it's 7 years of residency after 4 years of medical school. So it's not something that they hand out lightly, and you have to complete that as a first prerequisite. And I think that's something that's really important for the patients to know and understand, that some of these procedures may be performed in certain settings by people who haven't had that full amount of training. And I think it's really important that the patients not only look for board certification, but also take a look at the credentials and training of anybody who's going to perform, even a minor plastic surgery procedure is certainly still a plastic surgery procedure.
Well, Dr. Silk, I think those are very important points to bring up, and I appreciate that. Now, that's the first step, to finish an accredited training program. And then the second step actually is to pass a written examination. Isn't that correct?
That's correct.
Which is quite extensive.
That's correct. Yeah, I spent several months studying for the written exam, and that comes, right. You're eligible to take that shortly after you finish your residency. So that's step 2, is a long written examination, and that comes about 6 months after you graduate from your fellowship program.
Right, and then the third important step to becoming board certified, I recall very clearly, like it were yesterday, that you have to send them a list of every case you've done with the operative reports, et cetera, for an entire year, and they're poured over that list, and they select a few cases, perhaps 10 cases or operations, and then you actually go to Chicago or Arizona, where a group of plastic surgeons who are very experienced really grill you in the procedures that you're doing. Isn't that correct?
That is exactly correct. They make you compile a list of all your cases in the first year, so you can't even really think about taking the oral exam until you've completed training, and it's all stepwise. Then you have to complete your written exam. Once that happens, Then you send a case list to the American Board of Plastic Surgeons, and just as you said, they examine that and they pick from that some sample cases, which you then have to give a very in-depth presentation about, sort of like a dissertation defense if you were a PhD. In addition to that, they have 10 other randomly selected cases, and you do it over a 2-day period. I took mine in Phoenix, and they fly, plastic surgery program directors, so residency directors practicing academic plastic surgeons from all over the country. And I had a lot of the names of the folks that write the books, and certainly my examiners were really famous plastic surgeons. So it's a little intimidating when you're the young guy sitting there in front of these big names, and they're asking you, you know, how are you going to do this? But
of course.
That's how it works, and that's the final stage. And then even beyond that, they have maintenance of certification activities now. So it really is sort of an ongoing process.
Well, Dr. Silk, I appreciate you coming on, and once again, congratulations and welcome to the club.
Thank you.
Dr. Silk, the very important topic I want to discuss today is body contouring. There's a lot of misunderstandings about body contouring, really what it is, and it's becoming more and more popular. So what I'd like to do is to present some scenarios to you of different patients who come into the office and give me some feedback about how you might proceed or advise against body contouring in these cases. Is that okay? Great. So let's start with a 30-year-old woman. She's had 3 children, and she noticed that her shape has dramatically changed since she started having children, especially her abdomen. She notes loose skin.
Okay.
She notes some wrinkles in the skin, some stretch marks, and she also feels that the size of her waist is larger than it used to be. So how would you counsel her about body contouring?
Certainly. Well, I think there's several things to consider. You know, I think that the first thing you want to consider is whether this is a medically indicated or a cosmetic procedure. In rare circumstances where someone has a lot of overhanging skin, it may be something that they can even have covered by insurance, and that falls under body contouring. But most commonly, the 30-year-old that you're talking about who's had a few children has that loose skin. Things have stretched to accommodate the baby, and once that happens, it usually, you know, if you're lucky, everything goes back, but a lot of women, it's never quite the same. There's a couple things that happen. On the deeper level, on the inside, the abdominal muscles, the six-pack muscles, actually spread to accommodate the baby, and a lot of times that will never go back. They will always stay a little bit spread apart. It causes some of the hourglass shape to be lost, and it causes a little flattening of the overall kind of feminine figure. And I always tell the women that that's one that if you're that person that has that with the looseness, you can do every sit-up in the world. You could be 0% overweight. You could be absolutely at your ideal body weight, and your stomach may just never quite go back. The only way to do that is surgery. When you talk about the loose skin, it's sort of the same thing. Wrinkly, loose skin sometimes becomes stretched out, and it's just not going back. And, you know, within the first few months, you may see it shrink back to where it originally was. And if you're lucky, that's great. I think that the older a woman is at the time of pregnancy, slightly less likely that it's going to go back, although that's not a hard and fast rule. But the only way to really make that go away is to remove the excess skin, stretch things out, smooth things out, and that's what you'd be talking about. Most likely with the patient you're talking about, you'd be thinking about a cosmetic abdominoplasty or a tummy tuck.
Called a tummy tuck, right?
Sure, right. A tummy tuck would be the general name for it. Very commonly performed plastic surgery procedure, something that we can do in about 3 to 4 hours usually in most cases. It does leave a scar, as does pretty much all plastic surgery, so there's no scarless plastic surgery, and this one is one that you need to look at some pictures and photos of if you think that's something that the women are interested in, because there's usually a long scar along the bottom where we've had to remove that excess skin, and that's why that's why the scar is needed.
Okay, so in that scenario, a 30-year-old woman who's had 3 children and wants an improved abdominal contour, it sounds like you're likely to tighten up the muscles or correct the separation of the muscles or that stretched out fascia. In my office, I explain to women that fascia is a lot like the gristle on a steak. It's tough and leathery, but when it gets stretched out, there's very little that can be done apart from surgery to make it tight and smooth again. And then you'd remove the excess skin along with some fat. Dr. Silk, let's go on to a 40-year-old guy. He works out a lot, and he's lost weight, and he's got pretty good toned muscles, but he still has some love handles, and he wants to get rid of those love handles. Now, does he get a tummy tuck as well?
Well, you know, the tummy tuck surgery is generally for somebody who needs It's their excess skin removed. And it sounds like this point, you know, generally a 40-year-old man, they don't have the problems with childbirth. They don't have the changes that happen, the hormonal changes, all those things that change. You know, generally, a 40-year-old man like that who's in good shape but just can't lose that last 10 or 15 pounds, that's somebody that you think about liposuction with. And, you know, everybody's different. You have to be seen. There's no exact formula for everyone, so everybody has to be evaluated individually. But certainly that sounds like a good candidate for liposuction. And that liposuction is a surgery it's one of the most commonly performed plastic surgery procedures, where we literally suck out the fat.
So it sounds, Dr. Silk, like a tummy tuck or abdominoplasty is a much more complicated procedure than liposuction.
I would agree with that. I think that the tummy tuck it's certainly a more involved procedure. It depends, again, on the volume of fat that's being removed. There are certain situations where liposuction can certainly be complex as well, but in general, a tummy tuck is a much more involved surgery, although they're both generally performed as an outpatient, meaning you go home, do the whole thing in one day, and you can go home the same day safely.
One concept I find helpful in my practice in the office, I explain to my patients that there's what we call a closed approach to body contouring, and there's an open approach to body contouring. Essentially, the closed approach is liposuction.
That's right.
That's where we make very small incisions and put in a cannula or a tube and vacuum out fat. Or we can laser it or melt it or heat it up. There's lots of different ways to get the fat out.
Exactly.
And the open approach is where we make incisions to remove big blocks of skin and fat, tighten up muscles on the inside if we need to. And that's like tummy tucks and thigh lifts and procedures like that.
Yeah, I tell my patients I draw a line in my own mind between those with excess skin or maybe someone who needs an internal procedure. But the key defining factor, especially in liposuction, I think the big decision maker is whether the skin is tight and it's getting to tighten back up after you do this, or whether there is extra skin that needs to be removed. And once you suck out that underlying fat, if the skin has lost its elasticity, someone who's older, someone who's had children, then you may have to remove that extra skin because it may actually even be less full than before.
Great point, Dr. Silk, which is a great, perfect segue to my next scenario. The patient who comes in, this is a 68-year-old woman. She notices what she calls a waddle under her neck. It's really loose, soft tissue, and she wants to know if that can be corrected with liposuction.
Certainly, yeah, and everyone, as always, is different. You have to take a look, but if somebody who's at that age, most likely they're going to starting to have some early wrinkles, some laxity of the skin, some softness, some looseness, and probably even if they have, you know, there's two kinds of necks. There is, and they can occur in combination, but there's the loose skin with the sort of the two bands, the platysmal bands is what those are, that hang down under the neck, and the kind of unfortunate cosmetic name for that would be sort of a St. Bernard look, where they have the big hanging neck, and that's certainly the layman's term, but that's what people tell me. Or there's another look where they have sort of the underlying waddle underneath, which can be with a lot of extra fat, and that's sort of a bulge underneath the chin, and you can have both. And that's a great question because you need to really examine that person. A young person with a bulge is going to be someone that might be thinking about liposuction, and there's a whole bunch of liposuction options for something like that. But with the really hang down, loose skin at that age group, usually they're going to need the underlying tissues tightened up just as you would with a tummy tuck, because the problem is that things have loosened, there's extra skin, and the only way to fix extra skin is to remove it. So generally you're talking about someone that's looking at either a neck lift or a full face lift, and if they have extra fat underneath there, frequently we'll add a little bit of low volume liposuction in the area.
Well, Dr. Silk, you raise really an important issue, and I think one of the most important messages we can give to our patients is that people deserve an individual, customized approach, don't you think?
Absolutely.
I think the sort of one-size-fits-all approach is going to lead to a lot of dissatisfied patients.
I absolutely agree. It's every patient gets a full consultation. I know you do the same. Patients need a full consultation, a full aesthetic analysis, and that's part of what we go to school for and get tested on and become, you know, the board certification. That's a major part of all those things, is to be able to give someone a comprehensive aesthetic evaluation and then tailor procedures to them, because there are hundreds of ways to achieve almost any plastic surgery effect, you know, and you want to pick the right one for the right patient, and I think that's very important.
Excellent point, Dr. Silk. I appreciate you saying those things. Now, I've got one more scenario to present to you.
Certainly.
Here's a 50-year-old man who comes in the office and says that he has battled weight all his life. He's always wanted to lose 50 pounds. He's tired of dieting and trying to work out. So finally he comes into your office and he says, Doc, I want to have liposuction. I want to lose 50 pounds.
Oh, that's a great question, Dr. Morwood, because we certainly do see those folks. And I think that it's really important to think about these procedures for what they have, where their limitations are. Unfortunately, even with a large volume liposuction, you might take 10 or 20 pounds off, and that's a big operation for somebody. However, this individual needs a weight loss procedure. They need to lose weight, and if they can't do it through diet and exercise, the bariatric surgery is what they really need. And I see folks like this all the time, and I imagine you probably ask because you've seen this scenario many times yourself. These type of body contouring procedures, while you will lose a small amount of weight, anywhere from 5 to maybe 20, maybe even 25 pounds in an extreme instance, are generally not weight loss procedures. And if you got somebody who is majorly overweight and they're looking to lose weight, what they really need is a bariatric procedure if they can't do it any other way. They need to be on a supervised medical weight loss program, and I always make sure that the patients are doing that. If not, I can try and set them up with somebody locally usually. If all of those things have failed, though, then it's time to think about weight loss surgeries, gastric bypass surgery.
Which is another interesting point, that we see people who have a gastric bypass, or sometimes they'll have a ring put around the esophageal gastric junction, etc. And there's very different or varying different procedures for medical or surgical weight loss. And plastic surgeons oftentimes see those patients in the office after they've lost 75, 100 or more, 150 pounds, 175
Certainly.
pounds. So why would those people come to see the plastic surgeon after losing all that weight?
It's a lot what we talked about before. I think the first reason is because those procedures work, and that's why I'm happy to refer patients for them. And I think they'll work in a lot of situations where people haven't been able to lose the weight otherwise. But what happens after that is that the skin has been stretched beyond its limit, especially in somebody who's massive weight loss, over 100, maybe 200 pounds. Usually their skin has really lost its elasticity, and they end up with droopy excess skin all over. And I think a lot of the plastic surgery programs that are on television now are fantastic resources, for people, because I think they see these, if they're interested, they'll see these things on Discovery Channel and things like that about patients who've lost massive amounts of weight and what they go through, and that losing hundreds and hundreds of pounds is not a one-stop deal, because afterwards they're left with excess skin all over their body, frequently on the face, the neck region, underneath the arms, tummy, sometimes the breasts, and the medial thighs as well. And all of those areas can be addressed with surgery, and that's kind of the completion. And occasionally patients will come in and I need all of those things.
Dr. Silk, I appreciate that very much. Body contouring, Dr. Jeremy Silk, board-certified plastic surgeon. Dr. Silk, do you have a phone number we can give out if somebody has more questions?
Certainly. Salinas Valley Plastic Surgery. They can call anytime, 831-758-2746, and I'd be more than happy to see folks in consultation.
Dr. Jeremy Silk, board-certified plastic surgeon, 758-2746. Thanks very much for coming on the program.
Thank you, Dr. Morwood.
This has been a segment of Your Health radio and television program. I'm Dr. David Morwood. I am also a board-certified plastic surgeon. Thanks so much for being here. We're going to come right back after a very brief pause for